Hello dear students, welcome back to the 2-week online short-term course on Emerging Infectious Disease organized by the Department of Microbiology, Sree Narayana College, Kannur in association with the KSCST Government of Kerala. And in this we have already started Module 3. The next topic of Module 3 is the etiology, clinical symptom, transmission and preventive measures of emerging virus disease such as Zika virus. So I am Dr. Sree Narayana, Assistant Professor, Department of Microbiology, St. Pius College, Rajapuram, Kasaragod, Kerala. So what is Zika virus disease? First we will have an introduction. Zika virus is a mosquito-borne virus, especially mosquito Aedes aegypti and Aedes albopicus, and which are a flavivirus. It belongs to the family Flaviviridae and the genus is a flavivirus. And it is an arthropod-borne virus or arbovirus. And it is first reported in Uganda in 1947 in monkeys. And later it is reported in human in 1952, the same Uganda and in the United Republic of Tanzania. The outbreaks of Zika virus reported in Africa and the Americas, Asia and the Pacifics. In 1960 to 1980s, rare sporadic cases of human infections reported across the Africa and Asia. And the infection caused by the Zika virus is commonly known as Zika fever or Zika viral diseases or ZVZ. Okay, ZVD. The first outbreak of Zika virus reported from the island of Yap, that is Federated States of Micronesia, in 2007. And large outbreak of Zika virus have been reported in French Polynesia in 2013, Brazil in 2015, and which characterized by a syndrome called as Guillain-Barré syndrome. And later it is reported in America, Africa and other regions of the world. As of now, the latest report by the WHO, a total of 86 countries were infected, along with some union territories have reported the evidence of mosquito-transmitted Zika viral infections. And the next, what is the Zika virus and what is the structure of Zika virus? Zika virus has a, as you can see in the picture, icosahedral symmetry that has got an 50 to 60 nanometer in size, and the genome is approximately 10,794 kilobase, and the genome and the virus has got a single-stranded positive sense RNA which are flanked by two non-coding regions, that is a 5-2 3- non-coding region and a single open reading frame ORF which coding for a polyprotein 5-. And there are three structural protein, namely the capsid protein and the precursor, membrane precursor protein, and there is the enveloper protein. And there are several non-structural protein, NS1, NS2A, NS2B, 3, 4A, 2K, okay, and 4B, NS5, okay. Such a kind of non-structural protein that is very much essential for the replication and assembly of the virus. So this is the overall the structure of virus and the single-stranded RNA genomes feature. And how the transmission of Zika viral disease is happening? The transmission of Zika viral disease are mainly happening in two methods. One is mosquito based mode of transmission. Next one is non-mosquito based mode of transmission. Okay, here you can see in this image you can see this transmission. So the mosquito borne infection is the primary transmission mode by the bite of an infectious mosquito, that is Aedes aegypti, okay, in a tropical and subtropical region. Most of the tropical and subtropical region, the disease is reported due to the mosquito-borne transmission. Okay, and in Africa there is a specific type of transmission cycle is reported, that is known as a salviatic transmission cycle, where the mosquito is transmitted to various species of mosquito is transmitted to monkey. Okay, and it is transmitted to various monkeys, and mosquito and monkeys it is transmitted, and it is formed a cycle, and that is the monkeys and non-human primates such as rhesus monkeys. Okay, so that is known as a xylvatic transmission cycle. Okay, and in Asia it is mainly reported in human to mosquito transmission and human to human transmission. Okay, so in Asia that is human to human and human to mosquito. Here you can see that particular cycle. Okay, that is urban transmission cycle, that is commonly found in the Asia. Then Aedes aegypti, Aedes albopictus, okay, Aedes polynaciensis. Okay, polynaciensis. Okay, so these are the major type of mosquitoes. Okay, and that is transmitted through human and human to mosquito, and that is the transmission in the Asia. And non-mosquito transmission also is reported. Then the mother to fetus during pregnancy, the transmission is through mother to fetus, and the transmission is through sexual contact. Okay, and the transmission is through transfusion of blood and blood products, and the transmission is due to the organ transplantation. So these are the various transmission of Zika viral disease. And what are the signs and symptoms of Zika viral disease? The incubation period of Zika virus disease is 3 to 14 days, where majority of the cases are asymptomatic. There will not be any symptom at all. Okay, so but if it is symptomatic, the major symptoms are, you can see the headache. Okay, and you can see the fever, rash, conjunctivitis, muscle and joint pain. Okay, malaise and headache. Okay, headache or fever, the pink eyes. Okay, swollen lymph nodes, joint pains and muscle aches. Okay, and as I said, most of the people the infection will not be having any symptom, and the symptoms last for 2 to 7 days. Okay, and how the infection, when it is infected, if it is identified, how will you diagnose by laboratory based method? So the sample is a blood or other body fluid such as urine or semen. Okay, so you can take, and this diagnosis of Zika is primarily being carried out by RT PCR approach. Okay, RT PCR based test. Okay, the detection of a specific IgG and IgM antibodies also can be done. Okay, then the neutralization assay can be done. Next one is IgM captured enzyme linked immunosorbent assay or MAC ELISA can be used. Okay, then there are tests like plaque reduction neutralization test or PRNT, that also is a modern test that can be used for the diagnosis, and multiplex microsphere immunoassay or MIA also can be used. The details are you can refer by various sources. Okay, and the treatments are, there are no specific treatments available for Zika virus infection. The people with symptoms such as fever, rashes or arthralgia, they need to take plenty of rest and drinks adequate fluid, and treat pain and fever with the common medicine whatever that is allocated by the physician. Then if the symptoms are worsened, then seek the medical attention and advice from the medical practitioner. Okay, there are vaccines available, but it is not in a finally full staged vaccine. 2016 the FDA grant for approval of certain vaccine for human clinical trial, that can be used as a Zika vaccine. In 2017 the DNA based vaccines are approved for phase 2 clinical trials, and the same year there are some subunit and inactivated vaccines are also approved for the clinical trials. Okay, so as of now the treatments, vaccines developments are in progress. No successful final successful stories are reported, and we will hope that it will happen in the subsequent times. Okay, and how will you able to prevent and control Zika virus infection? Okay, so that is by various methods. The primary mode of transmission is mosquito. Thus, of course, obviously we need to use use the our strategies to avoid the mosquito bites. Okay, protection against mosquito bites, and the special attention should be required by the pregnant ladies. Okay, and the women of reproductive age and the young children. Okay, so if they are infected, it will lead to a lot of complications. The next one is personal protection measures need to be taken to avoid the mosquito bite. Then they avoid transmission in pregnancy. Okay, so virus transmitted from a mother to fetus during the pregnancy, that leads to a condition called as microcephaly. Okay, so try to avoid the transmission in a pregnancy. Then avoid sexual transmission with the infected person. Okay, to avoid sexual contacts with the infected person, so that we'll be able to prevent. Okay, so that's all about all these topics, dear students. Once again, we can at a glance through the topic, we can conclude and key points. What is the takeaway message from this particular session? So we have discussed the Zika virus disease, one of the major important emerging virus disease. Okay, with so many outbreak in 86 countries it has got infected, and we have studied the structure of Zika virus, the viral genomes and the icosahedral symmetry of the virus. Then what are the sign and symptom, although their major infections are asymptomatic, and how it will transmit. Okay, various modes of transmission, mosquito borne and non-mosquito borne transmission, and in various countries what is the transmission differences. Then we have discussed what are the laboratory diagnosis of Zika virus infection, and next we have discussed what are the treatment options that is currently available. Okay, and what are the preventive measures and control measures that is commonly available. Okay, so these are some of the latest references in which you can see some of the very nice reviews are published in the Nature, Frontiers in Microbiology. Okay, and that if you refer the site of WHO, okay, and Center for Disease Control and Prevention, if you refer, you will be able to capture lot of good and excellent information, dear students. And in my research groups, I've recently published a paper. Okay, that is in 2017 we have published. Okay, if you are interested, the recent perspective of genome transmission, clinical manifestation, diagnosis, and therapeutic strategies and vaccine developmental challenges of the Zika viral infection, that is published in one of the most popular SCI indexed journal. Okay, Frontiers in Microbiology. This is freely available in the net. If you are interested, you can look through it and you can gather the information. Okay, thank you very much, dear students, for watching. If you are having any doubts or clarification, you can mail me. Thank you very much.